So I'd like to welcome the attendees. But before becoming president of the National PTA, I was a Connecticut PTA president at the time of the Sandy Hook Elementary School tragedy. It was a tough time for our community, for sure. Sandy Hook Elementary was a PTA school, and Connecticut PTA mobilized that evening, that Friday evening, as a board to support the families and the students impacted by the tragedy. That weekend, our board met with town officials, government officials, and more than a dozen parents of the Sandy Hook school. We found out that the school was not going to reopen for quite some time and that they were going to move to a neighboring town. So the suggestion came up to create a welcoming environment. Being winter, snowflakes were the obvious. So we started a campaign called Snowflakes for Sandy Hook. In addition to that, we added a component of fundraising, and we determined as a group that the best place for those funds, because there were so many other groups donating monies for a variety of reasons, was to go into actually for mental health, to actually be there as a fund to track those children as they left the elementary school, went to middle school and high school. We knew that people throughout our community and country would also want to contribute, especially on the donation of funds as well as the snowflakes. So we sent out virtually a social media request just in the environment of Connecticut. Well, within a few weeks, we had donations from all 50 states, and we had donations from 50 countries. Millions and millions and millions of snowflakes were coming in for the decoration, not only of the school, but for the town facilities and for other schools themselves. And we raised a little more than $1 million within that year period of time. We stopped at the first anniversary. And that fund was created with the PTA of Sandy Hook and will follow those children throughout their career. So the Sandy Hook for Snowflakes campaign was a healing initiative by PTA for the state of Connecticut, but supported by PTAs throughout the United States and throughout Europe. And it decorated the halls of the Sandy Hook Elementary School and its environment in a winter wonderland to welcome displaced students and their families to their new school in Monroe. That $1 million, as I mentioned, is there to support potential mental health issues within the Sandy Hook school community. At the national level, what happened in Sandy Hook 6 years ago is unfortunately still happening today. Parents should never fear sending their children to school, and students should always feel safe in their learning environments. It's imperative that family members become effective, engaged stakeholders, and equal partners with school and community leaders in making sure that our schools are safe places for our kids to learn and to thrive. The time for actions right now. We can no longer sit back and wait for someone else to do it. That's why we're here tonight, to share with you some hands-on tools and tactics that you can use to start taking action in your communities immediately. I am very pleased with the panel of experts on today's webinar: Jackie Ball, National PTA's Director of Government Affairs, and Nicole Hockley, Founder and Managing Director of Sandy Hook Promise. First up is Jackie, and she's going to go ahead going to review some of the new tools that National PTA has developed to help families unsuccessfully engage in the school safety conversation. Jackie, thank you for your participation tonight.
Great, Jim. Thank you so much for having me. And thank you to Nicole for being on this webinar too. As many of you know, PTA has a very, very long history and legacy of advocacy on behalf of child well-being and education. This list of areas that National PTA has advocated on is just a sampling of the many issues that National PTA has engaged on. Not only has National PTA ensured that there were child labor laws and healthy hot school lunches, but also that there was an establishment of a juvenile justice system so that youth were not incarcerated with adults. Today, National PTA also engages on issues surrounding students with special needs, education technology and student data, school safety and the environment, along with many, many other issues. I urge you, if you haven't done so already, to check out all the amazing resources, information, position statements, tools to take action, and our public policy agenda at www.pta.org/advocacy. With that, I'm going to move to talking about what we're here to go over today is National PTA's advocacy and role in school safety and the environment. I want to share with you an important school safety resource that we have, the actually National PTA endorsed back in 2014, the Framework for Safe and Successful Schools. This doesn't mean that National PTA hasn't been involved in this issue. We have been involved in school safety discussion for a long, long time. This resource was endorsed by over 30 leading national education and child well-being organizations. It outlines evidence-based policies and practices for improving school safety and increasing access to mental health supports for children and youth. The framework encourages policymakers to design and implement a comprehensive school-wide approach to school safety that addresses school environment, safety, and learning as interconnected issues. The Framework for Safe and Successful Schools also has 3 supplemental documents on recommendations for implementing the framework, assessing the safety of the school environment using the framework, and considerations and action steps for implementing the framework. That last document, National PTA was closely involved in the development of that resource, particularly around suggestions and action steps that schools and school districts could take around engaging families and parents in this important issue. Next, I'd like to talk about a couple federal activities and also national PTA activities that have been going on in the last several months. As many of you may know, there is a federal school safety commission that was established by President Trump after the tragic shooting at Marjory Stoneman Douglas High School in Florida. The commission is tasked with providing meaningful and actionable recommendations to keep students safe at school. To inform a final report, which we expect to be released by the end of this year, if not early 2019, the commission has held meetings, field visits, and listening sessions across the country. There have been 13 meetings in total and 3 listening sessions. National PTA has had a representative, at least one representative at each listening session. Topics discussed at these meetings included mental health, school climate and environment, behavioral health, preventive measures, and physical security measures. As I said, we expect that the Safety Commission's report will be released by the end of the year, if not early January of 2019. I'd like to highlight a few resources and position statements that National PTA has around school safety. As Jim mentioned, National PTA has really increased our school safety efforts in the last 2 years. In August, the National PTA Board of Directors approved a new position statement titled Safe and Supportive Schools. This position statement is a comprehensive position statement on school safety. Highlights of the position statement include that National PTA believes the most effective day-to-day school climate to be gun-free, which includes not arming teachers and school administrators, but defers to local collaborative decision-making regarding the presence of law enforcement and school building security, such as a school resource officer. National PTA also believes that decisions related to physical security of a school must be locally determined, collaborative, and specifically include input from students, parents, families, educators, school leaders, and the community. Lastly, this position statement emphasizes National PTA's support for student support services and the adequate funding for these support services, as well as National PTA's belief that families must be involved in the development, implementation, and evaluation of school safety plans. So not only has National PTA Board of Directors adopted a safe and supportive position statement, National PTA is also releasing tonight 2 new resources for PTAs and parents. You can find these documents under the handout section on this webinar, and they will be shared via social media and other outlets as well in the coming days. The first document is Safe and Supportive Schools, Mobilizing Family Stakeholders. And the second document is Safe and Supportive Schools, 20 Questions Every Parent Should Ask. You can also find them on the webpage listed below, pta.org/school safety, along with many other helpful resources and information around school safety. This first resource is an advocacy-focused resource, the Safe and Supportive Schools, Mobilizing Family Stakeholders, which describes ways your PTA and you as an individual can take action to advocate on behalf of your child's safety in school and become an active stakeholder in creating a safe and supportive environment for all kids to learn and thrive. This resource includes important information you should review to get in the know about school safety, as well as tips for how to host a school safety forum and advocate to decision makers about school safety. The second document is one that parents can use to have a conversation with their school principals, not only about the policies and procedures that are in place in the event of an incident, but also to assess what type of preventative resources are available to students, families, and school personnel. This resource, Safe and Supportive Schools, 20 Questions Every Parent Should Ask, can also help parents and have conversations, have dialogue with school leaders about what type of communication channels are in place for families and students to have ongoing two-way dialogue and conversations with school leadership about any concerns or feedback around school safety and what happens in case of an incident. The document includes best practice tips to guide and support what every school should strive for. So I hope you'll take a look at those documents and share those in your community and among your PTAs. So how can you take action? It's really 4 quick and easy things that you can do today. First and foremost is to support and elevate National PTA's Safe and Supportive Schools position statement, in addition to the 2 new National PTA resources I highlighted. If you can share those on social media, hand them out at your PTA meetings, and share them among your social and community networks. The other suggestion is to have host a school safety forum. We've seen many PTAs across the country host school safety forums with school leaders such as principals, school board members, local police enforcement, and other community leaders, along with parents and students, to have a conversation about what students and parents and teachers want in their schools. And lastly, contact your members of Congress. National PTA has a very robust Takes Action Center on this issue and many other issues around the child well-being and education. You'll also actually, I failed to mention, following this webinar, we'll make sure to share with you some sample social media posts and tweets that you can use to share out the new PTA resources that we're announcing today. And with that, I want to thank you all so much for having me tonight. I really appreciate it, and I will stick around to see if there's any questions at the end.
Thank you very much, Jackie. I'd now like to reintroduce Nicole Hockley. Nicole is a founder and managing director for Sandy Hook Promise, where she leads and manages the organization's work, focusing on communications and outreach efforts and frequently serving as its spokesperson. After the tragic death of her son Dylan, one of 20 first graders killed at Sandy Hook Elementary School, Nicole focused on bringing people together in honest dialogue and searching for innovative solutions in the areas of mental health, school safety, community building, and gun safety. We've asked Nicole to share the suite of 4 free violence prevention programs Sandy Hook Promise has for schools and youth organizations nationwide, and to provide insight into tactics that families and PTAs can use to further activate around this issue. Nicole, thank you so much for participating on tonight's webinar. We're going to turn the presentation over to you now.
Great. Thank you so much, Jim, and thank you, Jackie. I hope you all can hear me. fine and dandy. I am through my computer, so hopefully this will work. Just wanted to going to talk to you about 20 to 30 minutes about different actions that you can take within your schools today to help prevent violence. To just start off on what that looks like, just trying to go down. Here we go. Purpose in speaking with you today is to provide an overview of who Sandy Hook Promise is, who we are and what we do and the how we do it. A little bit of a background in terms of how we arrived at what we do, because we want you to understand why we feel programs are so important. And then we're going to drill down into some of our no-cost, know the signs programs, what those programs are, the benefits and the impact that they bring to schools, and how we deliver them, so that if there's something there that you think that could work for your school, then you know how to get a hold of these programs and bring them in. And I will say that we don't say that you have to take all 4 of our programs. We don't say that we have the solution that fits everything. This is really about, these are options for your schools and your school districts to consider, either as complementing the work that you already do or filling any gaps. And at the end, just exploring how we can work together to create these safer schools and communities for everyone, and some actions that you can take to help bring that more to you. So a little bit of background in terms of who is Sandy Hook Promise. We are a national nonprofit led by several of the family members who lost loved ones at the tragedy in December 14th, 2012. I will say that we do not represent all 26 families of loss from Newtown, nor do we represent the town of Newtown itself. We are an independent organization led by myself, and I lost my son Dylan that day, and led by Mark Barden, who lost his son Daniel, and led by Bill Sherlock, whose wife Mary was the school psychologist and one of the first killed that day. The what we do is that we prevent gun violence before it happens by teaching people how to recognize the signs of these at-risk behaviors. We know, and we're going to take you in more detail about how these signs are often present in the instance of harm towards others or harm towards self, and we just need to learn how to recognize what those signs are, and especially as the students get practice in how do we take actions and intervenes, and how can we be more proficient and helpful in that way. We also do limit these identified at-risk youth and adults, their ownership or access to firearms until they're deemed fit. We're not about taking firearms or weapons away. We're just about ensuring that anyone who has access to that is in the right state of mind for that awesome responsibility. The how we do it, we educate and empower at absolutely no cost youth and adults in our Know the Signs prevention programs. And I'll go through these 4 programs in a little more detail in a minute. And I'll also talk to you about how we deliver and sustain these platforms through direct training, through digital downloads and interactive training videos, and how everything that we do is multilingual, and that we ensure sustainability of the programs by embedding them into student clubs, because that is really the best way to create long-term behavioral change. But first, a little bit of background as to how we came onto this strategy. After the shooting, we launched Sandy Hook Promise 1 month after the shooting, and I'll be the first to admit we didn't really know what we were doing. We just wanted to do something to ensure that we were preventing these kind of tragedies elsewhere, and using our voices to not only build legacies for those that we lost and those that survived, but also to just ensure that we created a safer place and transformed our tragedy into something positive for others. The first thing we did was dive into the world of policy and legislation, and we focused very hard on background checks and trying to get that passed within the Senate. In April 2013, when that failed, we took a big step backwards as an organization, and not in terms of going backwards, but in terms of stepping back and saying, what did we do wrong here? Because we're led by business people, including myself with a marketing background, and we said, it doesn't make sense to us if everyone says that this is the low-hanging fruit, that this is the way to go, and something as simple as this legislation can't pass, then what are we doing wrong? So we kind of went dark for about 12 months, doing some state work and some further federal work, but we really started to focus on this business problem of how do you take an issue that is so polarized and so divisive and find the common ground in which you can move forward. So we did a lot of both qualitative and quantitative research. We talked to academics across the country in terms of the fields of violence and victimization. We talked to a lot of educators and administrators and school board and PTA to understand what are the challenges and the barriers around violence prevention. We also talked a lot to law enforcement and gun experts and weapons experts, as well as mental health professionals to try to understand a little bit more about the state of mind someone might be in to reach that point of picking up a weapon to hurt themselves or someone else. And we spoke a lot to social movement experts as well, because we said as a country, we have had significant experience in taking a divisive issue and moving forward. So we studied case studies of everything from marriage equality back to civil rights to say, what are the levers that you need to pull in order to create change? Some of those levers that we discovered were in the realm of policy and politics, so getting the right laws in place and voting the right politicians in. But we learned that those two very important levers, which had been used exclusively in the gun violence prevention movement, are usually the last two levers that you pull. They're not where you start. Where you start is with legal work, if you can, grassroots voice and experience, really making it personal for people and getting them engaged in something, but also programs, education, education at two generations, really teaching kids and their parents how to create the social change that you want. And there's so many examples of this. If you look at recycling, that's a perfect example of where the kids taught the adults how to do this and what they needed to do. If we look at things like PSAs around strokes and how do you identify someone who's having the signs of a stroke and take action, or how do you identify the signs of someone having a heart attack or who's a victim of domestic violence, there's a lot of training that can be done and then create this change that you need. And I think one of the best social movements that can help explain this is around is a designated driver. You know, I'm 47 years old, and I grew up where drinking and driving, there were a lot of messages out there, and it was you wouldn't even think about drinking and driving. It was always about having a designated driver. And that program has helped save hundreds of thousands of lives over the years. There's no policy, there's no law called designated driver. It is a behavioral change that then helped enact policy solutions around blood alcohol count, for example. But it really started with that social change. And that's what we're talking about is social change. How can we prevent violence by being people that recognize the signs of violence before it happens and take action? We took all of those core learnings and used that to help form our strategy of how are we going to minimize these pathway behaviors and how can we best deliver it and sustain it in schools across the United States. The first and very important lesson we learned is that schools are safe from gun violence. They are one of the safest places to be in your community, although obviously we hear a lot about it in the media because schools are not immune to violence, suicide, or threats. They are still petri dishes of behaviors. They are still where all of these kids are coming together and everything on the spectrum of violence from bullying and cutting and substance abuse and dating violence all the way up to suicide and homicide can be found within schools, but that's not to say that schools aren't safe. There's just a lot of at-risk behaviors, particularly in the middle and high school years, where we can make a significant difference. And each year, there are hundreds of thousands of acts of youth violence and victimization. Now, I'm not going to go through all of these, and this study is a couple years old, so I'm hoping to get some refreshed stats soon. But in this year of this study, over 1 million students were threatened or injured with a weapon on school property, and 250,000 students were seriously considering attempting suicide. Those are startling numbers and numbers that we can do something about reducing. Those acts continue to undermine individual and school safety. They take away from academic time. It creates a stressful school environment. It can lead to further trauma and mental illness. And at its extreme, of course, those numbers can lead to a loss of life via suicide. The second core lesson we learned was that gun violence and victimization is caused by a lack of mental wellness, not mental illness. It is actually the people who have a diagnosable mental illness are far more likely to be victims rather than perpetrators of violent acts. It's actually people that have this, what we call a lack of mental wellness. They don't have the coping skills. They don't have anger management skills. They don't have typical conflict resolution skills, and they have access to weapons and the means to carry out on their threats. So this is really where we're focusing more on rather than someone with a diagnosable mental illness, except of course in the case of suicide, where someone who's suffering from the disease of depression can go down this route as well. The third lesson that we learned is that there's almost always signs. We learned this from threat assessors and law enforcement, including the FBI. We learned this from studying reports of school shootings, and we learned from studying a lot of other acts of violence. And almost always there are signs and signals given off. It's called leakage from someone before they're violent or they attempt suicide or they make threats. A lot of these threats, as you can see, are shown on social media, and this stat is actually about 2 years old now. So I'm sure if I had updated stats to hand, that I would bet that number has increased even more since then. 80% of school shooters, 4 out of 5 school shooters have told someone of their violent plans, at least one other person, before they committed their act, with 69% telling more than one person. Most mass shootings are planned for over 6 months, and up to 70% of people who complete suicide tell someone of their plan, give other warning signs. So those are incredibly high numbers, but the good news is that's an incredibly high of potential interventions. Because if you think about those 4 out of 5 shooters who tell someone of their plans, if those 4 people who are told create an intervention, that is less school shootings that are going to be happen. We also know that youth start to display these at-risk behaviors predominantly between the ages of 13 and 17. So that's why we focus our programs specifically on middle and high schools. We have been asked about elementary schools before, and we have been asked about secondary education before. That's not where we're going to focus right now. It's really all about grades 6 through 12 and how can we teach those kids and the adults around them how to recognize the signs and create these opportunities for intervention. We also learned that there's really no national programs to help teach how to recognize these signs and signals. Where there are programs, they tend to be regional and sometimes quite fragmented, even across one district. They don't always have a lot of measurement and evidence of the impact of those programs. And a lot of the times the programs are one and done. One of the things we learned a lot from schools when we were teaching them was that they felt programs were fantastic, but what we heard was, you're kind of flavor of the week for that period of time or even for that month, and then we don't hear from you again until the next year. So we learned a lot about how to sustain the programs and ensure that these stay front of mind in our kids' lives every day, so that it really does create that behavioral change rather than just once a year we focus on something. We also realized that schools were challenged in delivering these programs nationally in terms of the resources to pay for them and the limitations on teaching time because of the academic priorities of schools. So we wanted to make sure that we addressed all of these barriers when we were developing our programs. In conclusion, we decided to be the organization that would educate people how to recognize these signs and signals and deliver all these programs at no cost to any school, with multiple platforms to ensure that we're meeting the needs of the school and their time constraints and their requirements, and that we would sustain these programs through both in-district support and by empowering youth through sustaining the programs into student clubs. So what does this look like? Well, we have our 4 Know the Signs violence and victimization programs, which I'm going to take you briefly through now. The first program that we offer is Start with Hello. This is where we teach our students how to identify and minimize social isolation. This isn't about this isn't about healthy alone time. We really do teach the difference between someone who needs healthy alone time versus recognizing someone who is consistently withdrawn or is consistently pushed away, and how do you reach out and help someone. There are so many stories that we share about how just a simple smile or creating eye contact or saying hello to someone can truly change the trajectory of their lives, or at least their decisions that they make that next day, because you just don't know what kind of day that person is having, where they've just come from, and what they've just experienced. And that knowledge of being seen and being validated and feeling included can go a long, long way in helping kids who might start off at one end of the spectrum of low self-esteem, not feeling connected, feeling completely isolated, that can then go on to go towards other elements of the spectrum, towards at-risk behaviors and self-harm and violence towards other. So the key outcomes of Start with Hello include really creating that connected community. We've also got a lot of reports from the schools that participate in this, that it's reduced bullying, and in created cafeteria environments where people are sitting together, that no one is sitting alone, and that if someone is seen to be sitting alone, unless they're studying for a test or something, that people are going over and sitting down with them. And the program itself is beautiful. It's taught within a classroom environment or an assembly environment. It takes about 30 to 40 minutes. And we do a lot of role playing with the kids in terms of what does it look like to start with hello? How does it feel? Why would you feel uncomfortable going up to someone you don't know and saying hello? And really help creating a lot of activities and icebreakers that the kids can do and bring to their school to help create that feeling of connectivity and socialization. And some of the schools come up with some fantastic activities. We have one of our clubs in one state who actually every Friday now, the club has decided, I think it's a school in Miami that has about 4,000 kids within it. It's one of the largest schools in the district. And every Friday they put on name tags, hello, my name is, and then they go around and say hello to each other throughout the course of the day. And it's really about ensuring that everyone gets spoken to, everyone gets seen, everyone gets a hello. And it's just making the community feel more together. Our second program is Signs of Suicide. Now, this is the only peer-reviewed suicide prevention program in the States that's proven to reduce suicidal ideation and suicide attempts. And this is where we really go in specifically and we train trainers within the school. It could be a health worker or a social care worker who then can go and create more classroom teaching in a smaller and intimate environment to help identify and intervene and get help for those kids who might be feeling chronically depressed or potentially suicidal. And through screeners and education around the aspects of depression and suicide, it helps break down these stigmas and allows these kids to either self-report and get help for themselves or to speak about a friend that they feel could be ideating, and then for the school, for that teacher, for that social worker to take an intervention and get that child help. So it's really helping everyone to better understand what does depression really look like and how can you help someone before they make a tragic choice. And this again has helped thousands of students already. It's a program that we're helping nationalize. It's actually run out of Boston. It's been around for a number of years, and they have incredibly impactful rates of interventions and getting kids help. The third program we offer is called Safety Assessment and Intervention. And this is actually a program for the adults in a school. And this is where we train a multidisciplinary team within a school how to deal with all these threats. So it could be a principal, a vice principal, an SRO, a teacher, a social worker, in terms of bringing that little, 5 to 6 people maybe together in a school and saying, okay, we're seeing all of these threats around the school, whether it's bullying, whether it's a threat of violence, whether it's fighting, whether it's even graffiti. How are we going to deal with all of this? And how are we going to decide what is a substantive threat that we need to deal with right now? And we teach protocols on how do you determine if something is substantive, if it's imminent, if it's truly potentially life-threatening, or what is the difference between that and a more transient threat that could escalate over time. So there are protocols that we work with you to establish and then determine how these threats are going to be managed so that the kids don't fall between the cracks. And it does have fantastic impacts. There's a school that we taught last January in Ohio, at the start of January rather, in this program. And within a couple of weeks, they came back to us and said, we've already had the chance to use this program more fully. We had our first substantive threat, and we did exactly what you taught us to do. Instead of suspending the student, which would have been our previous protocol, we kept them in. We created safety nets around the student. We reached out to the parents, and we dug deep, because although there was a threat, the safety assessment and intervention program teaches you how to dig deep to find out what's actually going on elsewhere that could cause this child to act out in this way. Because sometimes there's a lot more, the threat itself is usually just the tip of the iceberg. And they were able to really get this child help, because they had not only uncovered the threat itself, but they also uncovered plans and stockpiling. So they were able to avert and act before it happened, that could have resulted in a school shooting. So this is a very, very, very good program. It's actually run by Dr. Dewey Cornell out of the University of Virginia. It's also evidence-based, and it's something that we're very proud to be able to offer on a national scale. Our final program is Say Something, which is an evidence-informed program. And this is where we teach students how to recognize at-risk behaviors and signs, especially in social media, within their peer group of someone who might be a threat to themselves or someone else. And then we teach them how to say something to a trusted adult or to report it using our anonymous reporting system or whatever school system you use for anonymous reporting. We find this program is really leading the way with a lot of schools, because especially of its social media element, the kids are seeing threats and violence and anxiety played out on social media that the adults in their lives are not seeing. They are very simply, the kids are on different platforms than the adults, sometimes platforms that I've never even heard of, frankly, and teaching them how to look at something and take it seriously really is a big difference. And when we ask kids, why don't you say something when you see these things? Because we've seen instances of people who complete suicide, who put out a tweet, for weeks in advance about, I'm giving away my possessions, or you'd be better off without me, or even on that morning saying, I finally got the gun, and they're getting a lot of retweets, but no interventions. And the kids say, well, if they're putting it out on social media, they're not serious. They're just looking for attention. They're just seeking drama, and I don't want to get my friend in trouble. This is all about teaching our kids that if you see something, you really have to take it seriously, because for someone to put it out there, there's something going on in their life that means they need help. And you're not snitching on them, you're not ratting them out because you're not getting them in trouble, you're getting them help. And that's the difference between snitching and saying something. Saying something is about getting someone help. So it really fosters this upstander culture of leaning in and not just being a passive bystander or a retweeter or a like on Instagram. It's really about leaning in and saying, I'm going to look after my friends, and I'm going to look after my school and my community. We're seeing a reduction in violence, suicide, cutting, and bullying with this app, with this program in itself, and getting a lot of kids help. But there's also this element of, we teach people how to say something to a trusted adult, and we role play that during the training, but we know that that's not going to work for all kids at all times. There are going to be some kids that don't feel they have a trusted adult in their life, or that, if it's 2 o'clock in the morning on a Saturday night, they don't know who to go to in that moment. Or if school's not in session anymore, it's August 1st, who do I go to now? So we also developed the anonymous reporting system to help kids with and parents with another option. So this is a 24/7, 365 free app, website, and 1-800 number, 1884 rather, 844 rather. And in this way, kids or their parents within a school district can report any form of violence or victimization or at-risk threat they're seeing. For anyone who looks at the app, which is available today, it covers everything from drug use and substance abuse and dating violence and cutting, bullying, all the way up to school threats and suicide. It's an incredibly comprehensive system. and it is available, again, at no charge for school districts across the country, because we just want to have the greatest impact we have and get as many kids help as we can. The way it works, if your school district decides to take this, is the youth or an adult, because let's face it, you parents know, sometimes your kids come home from school and they tell you about what they heard and they don't know what to do. So this is a tool that the adults can use as well. You submit the tip using the app, website, or phone. The tips are all received by our multilingual crisis center that has a couple of dozen crisis counselors on hand, all with over 500 hours training in crisis counseling to deal with the tip, triage it, get as much information as they can, and then disposition it out to local law enforcement or the school team, depending on whether it's deemed a life safety threat, someone's considering suicide right now, or an act of violence right now, or a non-life safety threat, such as bullying, such as graffiti, even, you can report. And then everything is case managed. It's a fully case managed system. It's a platform that law enforcement and the school can work on together. It's completely anonymous gateways, so the tipster is protected, but there's a full audit trail. And our crisis center ensures that law enforcement or the school teams complete information on all the interventions that they make, so that we're ensuring that no kids falling between the cracks. That's our goal, to ensure no kid falls between the cracks, and we're getting the real-time tracking back to the schools of what's going on and where they need to provide more help. At the moment, with the anonymous reporting system, we're in the process of being live or onboarding in about 152 districts. Right now, we tend to only do this at a district level in 25 states. The state of Pennsylvania last month announced that it would be taking this system across their middle and high schools in the state under the Safe to Say Something brand. And we have about another 300 districts lined up before the end of this school year. So we're now starting to take requests for next school year as well. And of those tips that have been submitted to date, and there have been far too many, about 62% of them have been life safety tips, so have been dealing with kids that are contemplating suicide, that are talking about bringing firearms to school and committing acts of violence. So it is quite serious stuff, but it is making a difference. And just to give you a feel of some of the sorts of tips that we got this past summer, because our system's 24/7 and not just during the school days, we had this 8th grade student who came forward about her friend that was considering different methods of suicide. They located the team located the student's address and intervened in time. And as I recall from being told, this was as the student was actually in the process of trying the act of violence against herself. So she got the help that she needs. We also had at the beginning of this school year a tip about a hate crime, hate language, and talking about shooting people. And that tip was reported. It was determined that the child did have access to weapons and therefore means, and the response teams were activated to get to that student in time. And I believe from when the tip first came in, it was 31 minutes until that intervention was made in time to take care of that child and also ensure that they weren't able to go forward with any of their acts. At the same time, there was another one about using our Say Something app at lunchtime, about a friend that said he was going to shoot himself because he was very depressed after the incidents of breaking up with his girlfriend. Again, the team was able to intervene on that student within 13 minutes and get that child the help that they needed to support and resources to ensure that they didn't hurt themselves. And unfortunately, there are far too many stories that we can share. Our anonymous reporting system was launched this past March, and with the schools that are already on board, we're onboarding about 1 to 5 districts every few days, and the data that's coming in is heartbreaking, but also hopeful, because we know that we're getting these kids help. While we're helping to prevent gun violence, which is our nexus, we know that we're helping students everywhere. Because really only about 6 to 8% of these kids are ever actually going to go on to become violent and hurt themselves or someone else. But the programs are helping that other 92 to 94% as well. Because let's face it, and we can all think back to our middle and high school years, someone needs help at some point. We all need a little help at some point. So even those who might never become violent, they might suffer from other at-risk behaviors and struggle with substance abuse or cognitive impairment or physical ailments as a result of stress or depression. So it's really about helping all, even though our specific nexus is gun violence. So before I close, just thinking about delivery and impact, just to again reiterate, we deliver all of this at no cost. We made a promise that money would never be a barrier to saving a life. We have direct training. We have about 125 national trainers who can deliver the programs in schools, or we have digital downloads where you can download the program and teach it yourself, or we have Say Something as an interactive learning video as well. Sustainability, we embed all of the youth programs into existing leadership clubs. If you have a Students Against Destructive Decisions club, or you work with a Boys and Girls Club, or you have another leadership club, we don't ask you to build a new club. You can put the programs right into there. Or if you don't, we'll help you create a SAVE Promise Club. SAVE stands for Students Against Violence Everywhere. We have call to action weeks to help support these activities. In September, we had our Start with Hello call to action week. We're just finishing up the audited numbers there, but about 4,000 schools have already come back and told us how they implemented the program, which is about roughly 2 million kids were trained in that 1 week. And we provide all the materials and collateral for free to help with the students and the community and parents. Just a little bit there about Save Promise Clubs. We really believe very much in student empowerment and student agency, because they're the ones that are leading this change, and they're the ones that can create this change within their school. We give them monthly activities to do, as well as the call to action weeks, and we have an annual summit. This last year, we had about 423 students attend from 23 states, and all of the workshops, all of the seminars were all led by students sharing their success stories from their schools. In terms of overall impact, barring Start with Hello Week a couple of months ago, because we just got the audited figures on that, up till that point, we'd already trained 3.5 million youth and adults since our first tip sheet was launched in November 2014. We are in every single state, little over 7,000 schools at the moment. We've intervened and stopped multiple school shootings, suicide threats, and gun threats, as well as reducing a lot of other at-risk behaviors, everything from bullying and cutting all the way up to the other forms. And we've helped get hundreds of kids to the mental health and wellness assistance that they need. So what does this mean for you, and what actions can you take? Again, we're heavily evidence-based and informed. We're creating upstanders across a district. We provide you with one consistent voice and training, which is incredibly important, comprehensive delivery and sustainability. And we're really working with the schools to ensure that we're doing all the work for them so that they don't have to, so that you can just focus in your school on teaching the kids, creating community, and helping them with their learning. So what you can do today, you can get involved with Sandy Hook Promise. You can go to sandyhookpromise.org and make the promise. You can become a promise leader, which is currently one of about 6,000 super ambassadors across the country, helping bring the programs to their schools and districts. You can become a trainer or a virtual volunteer, and we're going around different geographies all the time, training people on how to be our ambassadors within schools. You can also help donate to help us train more students and keep our programs free at all times. And really just think about your school. What do you need? If you heard something today that resonated with you, if you heard of a program that you think your school or community could use that, then please help us bring this program to your school. And that is the email that you can go to for more information. And with that, I'm going to hand back over to Heather. Thank you.
Thank you very much, Nicole. What a terrific and valuable presentation. Really appreciate that. We're now going to open the session up to audience questions. Heather, why don't you take it away?
Sure. We have time for a few questions. Nicole, there is a question for you about where can someone find information about having someone from Sandy Hook Promise come out to the school for a training?
If you're interested in that, that's a great question. Thank you for asking. You can send that request directly to programs@sandyhookpromise.org. Email it in, and it will get to the right person who can then make that happen for you.
Great. And given how busy administrators are, Nicole, what is the best way to get a principal on board with school safety and initiating some of these programs?
That's another great question, and I wish we knew the secret sauce for how to get into schools. Sometimes it's around parents going in together and talking about this. Sometimes it's about a champion within the school who's heard about it, or word of mouth from other schools. But also, we're happy to help with anything. So if there's a principal who wants to learn more, myself or a member of my team is more than happy to sit down with that principal or talk them through over the phone the ease of doing these programs, and also the benefits it'll bring to the school.
Nicole, is there a list of districts that are already involved in it doesn't say involved in what? I'm assuming in the anonymous reporting program that you offer?
We don't publicize that at the moment because we're protecting the schools, but we do have lists available. So if you wanted to find out if there's something in your area already, what schools are in your area that have it, or your nearest schools, you can certainly email us and ask, and we can let you know what's available in your community.
Great, Nicole, this is a speed round for you. What is involved in becoming a trainer?
A trainer, we train people
Mm-hmm.
hard. Yep. So we train our trainers for about 2 months, over a 2-month period rather. It's usually several intensive days and learning what the programs are, especially focused on the student programs. We start with hello and say something. And then sometimes we then select people to go on to the adult programs as well. But they are intensive training. You learn the programs, we then watch you, coach you, and there's an auditing period as well where we, before we send you off into a school, we check that you really understand what you're doing and that you're best representing the program and the fidelity of the program within the school. There are also things like that we need to do, like background checks on you, and some schools require different medical tests as well, even we've had, to ensure that you are meeting their protocols before you can go into a school and represent as Sandy Hook Promise.
Okay, great. And then the last question. I'm sorry, Nicole.
I was just going to say we do pay hourly rates for our presenters as well. They're not volunteer, they're contract per diem people.
Terrific. Sorry about that. So have there been any issues with privacy related to the anonymous reporting tool? And this was as it relates to the student who might be at risk.
We have not had any problems yet. So far, the schools that we work with have kept the students in question. They have honored their privacy and not shared it out. There have been other schools that we are not in where we hear stories of students who other students were made aware of that they had made threats, or that the community had been made aware. And that is very tricky because that creates a lot of stigma and makes it very, very difficult for a child to reintegrate back in, and certainly excluding them really only exacerbates the problem and not, further isolates them and ensures no adult supervision really. So we work closely with the schools to ensure that those kids that are reported on, that tips are submitted about, that they remain anonymous, but that is certainly the tipster remains anonymous, and it's working with the schools and local law enforcement to ensure that the child who is perceived to have to need help is also kept is honoring their anonymity as well.
Have there been any issues with abuse of the system or false reporting that you all are aware of?
Yes, and that does happen, especially when you first launch the system. When we first train the kids, first of all, you'll see an increase in the number of kids submitting tips. That's in part because they're testing out the system. It's also in part because they're already aware of at-risk behaviors and they haven't had a tool to use to submit tips about that before. We do we do see false tips, but it's less than half of 1%. So when you think about the total tips that a school will get, and it's not like depending on the size of the district or the school, we're not talking about, hundreds of tips every day. It does balance out over time, but the false reporting is relatively small. I mean, half of 1% is what we're seeing at the moment.
Okay, great. Well, that is all of the time we have right now for questions. One of the questions that we had, my apologies for the error in the beginning of the webinar. I was actually on mute. So Jim, my apologies for you thinking it was you. It was me. What I was saying was that this webinar will be recorded. I will send it out to all of the attendees tomorrow morning. We're also going to make the webinar available on pta.org/school safety. We're also going to push it out on social media, so please feel free to share it widely with your social circles, your network. That would be great. We would really like to thank our panelists tonight, Jackie Ball and Nicole Hockley, for this wonderful presentation. Here is Jackie and Nicole's contact information. For any questions that we were not able to get to tonight, I will send the questions to the appropriate people. It looks like the majority is for Nicole. So I will send these directly to Nicole, and perhaps she can answer them privately. Again, just like to thank everyone for their time and for participating on the webinar. So this concludes our session, and we hope you have a wonderful night. Thank you again.